This video will discourage a lot of you, I'm not gonna lie. I'm back. Hi guys, and welcome back to my channel. I have been absent for longer than I cared to admit. Yes, but I am back with the new couch. Those who have been paying attention, I've switched couches 3 times now, and I wouldn't be surprised if I'm gonna switch again. For those of you who have stuck around and are already subscribers, thank you very much. And for those of you who have not subscribed, hi, my name is Melanie Luna Diaz, and I am an endodontic dental assistant. Yeah, but let's get back to you. How are you doing? Are you doing good? Have you gotten the vaccine yet? I have. I am actually due for my second dose in 3 days. So we'll see how that goes to see if I am still alive or not. So many of you have read the title. This is going to be the first part of a 2-part series called Pros and Cons of Being an Endodontic Assistant. So yes, for today's part, I'm going to do the cons first. All right, so let's cut to the chase. This video is not for the weak of heart, the weak of mind, and the weak of soul. It takes a special kind of person to be an endodontic assistant. This video will discourage a lot of you, I'm not gonna lie. But my next video will encourage you guys. Okay, so the first con of being an endodontic assistant is you will most likely not be getting out of work on time every day. If you don't know what a root canal is, just know that people usually get them when they are in pain, making this profession an emergency profession. To give you a little bit of insight, during the most dental offices like orthodontics, general dentistry places were closed down, but endodontics were not, because we are considered an emergency facility, which means we take in emergency patients as well. So what that means is if it is 4:50 p.m. and you're supposed to clock out at 5, but you get a call and it's a patient and they're saying that they're in a lot of pain, you will most likely have to get that patient in.
They ask you how you are, you just have to say that you're fine when you're not really fine, but you just can't get in.
So therefore you won't get out in time. And also what can happen is if you have a little 30-minute exam scheduled and then a whole bunch of treatments afterwards, but that 30-minute exam turns into a pulpectomy because the patient is in so much pain, that's gonna set your schedule behind a lot and you're not gonna get home on time. You're gonna miss dinner. Con number 2 is that sometimes you don't get to eat. Yeah, so I only say this because usually in endodontic offices, they schedule the treatments with no blockout time for lunch. At least that's all the places that I've seen do that. Let me know down in the comments if you work at an endodontic place or if you've seen an endodontic place that does block out a time for lunch. But so far, I have not seen one. So we don't get a time to clock out for lunch. Basically, it's just if you find a little time slot to eat, then you take it. Okay, so con number 3 is that the procedures are lengthy. On a good day, a regular root canal treatment on a usual molar tooth takes about an hour and a half. Okay, fine. On a good day, maybe an hour 15, but usually they take about an hour and a half. And that's without any complications. So if it has complications, you're looking at more. Just know that you better go to the restroom, drink your water before that, you know, stretch, whatever you feel like you need to do to get prepared for an almost 2-hour procedure. Root canals at an endodontic practice do go faster than root canals at a general dentistry practice, just because in an endodontic place, say that 5 times fast. Endodontic office, endodontic office, endodontic office. Like if you can say that 5 times fast. But yeah, so it can take a long time. And if you don't have a good relationship with your doctor or anything, it can be even longer. For us, the doctor that we work with is extremely funny and really friendly. And so during the procedures, we usually have the patient with some headphones so they can't listen to our conversations. We don't say anything bad about the patient, okay? But it's just, it makes me feel better talking when I know that the patient doesn't hear anything. Anyways, so yeah, me and my doctor actually really have fun working on these procedures because we talk and we laugh, and it's just, find yourself an endodontic practice that has a really great doctor so that these procedures won't be as long. Hi, I got closer. Another con is that endodontic offices work a lot with nitrous. If you don't know what nitrous is, it's usually referred to as laughing gas. It comes in pretty colors and it usually smells really good too. Most of our patients use it because most of our patients that go there are kind of terrified of being there. It usually makes patients feel very at ease because it kind of makes them feel like they're floating, like they're tipsy. So we use that on, I would like to say, 95% of our patients. However, nitrous is dangerous. Why is it bad, you may ask? Well, for one thing, it can cause infertility. It doesn't stop there. If you are pregnant, it can cause spontaneous miscarriages. So basically, being exposed to nitrous or secondhand nitrous, if you're a girl, is pretty bad. And usually you can get exposed to that if the mask is too big for the patient's nose and you have the nitrous on them, then that means that the nitrous is coming out of their mask and you're basically exposed to it. If patients are talking to you while they're on the nitrous, that also exposes you to secondhand nitrous.
You're exposed.
And also, sometimes they get so claustrophobic. I don't know what I did that. People actually do really get claustrophobic.
Stop it, Patrick, you're scaring him!
Because not only do we put the nitrous mask on them, but we also put the dental dam on them. And if you've never had a dental dam on, it basically covers half of your face area. So basically you have a big old green thing right over here and then a big old nitrous mask right over here. And also we use a microscope, so there's a microscope like right in front of your face. So that can make people feel claustrophobic. And these patients are crazy. They feel so claustrophobic that they just rip the mask off of their nose, exposing us all to nitrous. So yeah, nitrous, be careful. And action. So that concludes today's video. I will be back with another one. And next time I will be back with pros of being an endodontic assistant. Okay, yeah, so once again, don't forget to like, subscribe, click that notification bell, and I will be back next week. I hope that this video didn't discourage you guys, because even though there's a lot of cons, there is a lot of pros. So just keep that in mind. And I want to thank you guys again so much for the support. I'm almost to 5K subscribers, and that is 5K more subscribers than I thought I would ever have. So yeah, thank you very much. Okay, bye.
One small step